Welcome to the National Center for Health and Public Housing's podcast. Today, we're going to focus on promising practices addressing barriers and unmet needs of people living with disabilities that are residents of public housing. Our guest today will be Katina Washington, Branch Chief, Grants and New Funding, Assisted Housing Oversight Division at HUD. First, I want to welcome Katina and thank her for taking her valuable time to join us today. This, as I mentioned to you, Katina, is geared to an audience that includes an awful lot of health center folks in various capacities. There are clinicians, there are education and outreach people, there are community health workers, there are quality folks, there are executive suite, people who might be listening. We also have a fair number of folks from housing agencies, as well as community-based organizations. And I think they will all be very interested in what you have to say about the 811 program. Health centers and a lot of folks are familiar with public housing in general, but not of all the and the different types of resources and the different types of folks who live in public and assisted housing. So I think this is going to be a great source of information for all who are listening. And so, Katina, if you don't mind, if you could begin by just telling us a little bit about your background, prior to maybe 811, and then your role in the 811 program. So please go ahead.
Yes. So I've been working at HUD for close to 16 years. I initially started working on Section 8 programs when I first joined the department and, occupancy and all of those things. And then about 14 years ago, I moved over into the grant side and working on some of the Section 202 programs and the Section 811 programs and assisted living conversion program. I'm full-time started working on the 811 program probably about 10 years ago. I started as a kind of a program lead, and now I am the branch chief in the grants area, over a supervising the programs. In the 811, initially as a program lead, I did all of the notice of funding and opportunities, which allows the public to know that we have money on the table. So I was very instrumental involved in the last couple of notice of funding opportunities. I've been able to draft them. I'm also involved in a lot of the policy decisions with the program and sort of the outreach and communication. So I've been doing that for the last 10 years. But now I supervise the area. My team is very instrumental in doing the same thing, getting the notice of opportunities out, policy in the program, like reviewing the applications, working with stakeholders involved in the 811 program.
All right, very, very good. All right, well, it sounds like you're a good person to talk to about all this. So let's get into the details a little bit. And
Yeah.
could you please kind of give the audience a brief explanation of HUD's 811 program, its purpose, the people it serves, who are the grantees, what kind of services do they provide, and who is eligible for the 811 program?
So the 811 program, just to be brief background, the program came to existence in 1990. So it's a pretty long-standing program for the department. It's one of our, what we call bricks and mortar. So we actually build the buildings where most people, when they think about public housing, it's through their local housing authorities and they kind of provide the assistance. But for 811, this is, one of HUD's longstanding development program. So we actually provide the money for the construction of the actual building. And some of those buildings could be either an independent living that we call it, or small group homes or condominiums, like scattered site condominiums. So, we provide that construction to nonprofit organizations who are interested in affordable housing and development space. A lot of our owners or people participating in the 811 program are actually nonprofit sponsors who are mostly mission driven. So they are, used to serving this population. So they're, want to also provide housing, not just the services. The 811 provides an operating assistance to not only do we provide for the construction or the rehabilitation or purchase of these 811 properties, we also provide the operating assistance in form of a rental assistance, in form of a subsidy. That subsidy is paid out to the owner, and all a resident would have to do is qualify to live in the 811 in order to be eligible. The program serves very low persons with disabilities from ages 18 to 61. Very low means that you have to be 50% below the area median income in order to be eligible to live in an 811 unit.
Okay. And in
And
terms of
yeah.
the organization in general, so the brick and mortar stuff, okay, pretty clear.
Mhm.
So are the grantees required to provide any kind of enabling services or support services to residents in addition to just the housing facility?
Absolutely. So they are actually statutory required to provide services in an 811. So when they apply for this funding, they have to certify that they will have a provision of supportive services within the property. This is supposed to be a long-term, sustainable, long-term services. So they are required to keep on hand a supportive services plan that address the needs of the population they will be serving. They're also, when they apply for these funds, can, we don't like to use the word targeted, but they can structure the supportive services to the type of disability that they will be serving within that. So, developmental disability or intellectual or developmental disability, or those with physical disabilities, or any of those disability types, they can kind of structure their supportive service plan in that. And in the supportive service plan, they should be, addressing either activities of daily living for those residents within the property. That means they can, provide assistance through meals, dressing, grooming, assistance with paying bills, or any of those. They can have that structured out in their property. In addition to 811 is also, they can have a service coordinator that helps coordinate the services for the persons, the residents. So that's also available through the operating assistance. So that could be paid for through the operating assistance, and a portion of the supportive services can be paid through the operating assistance with up to $15 per unit per person.
And can you talk a little bit about the role of a service coordinator?
So the role of the service coordinator is really to coordinate services. It's not to provide direct services, but to coordinate services to within the community. So any residents' needs, such as transportation, any of those, this resident service coordinator can coordinate those services for the residents.
And overall, what kind of connection do the services offered have to healthcare for the resident? Is there a link there?
Yeah, sometimes there is a link depending on, what the owner is proposing in their plans. Like sometimes they have like partnerships with, local health centers in the area. Um, it's very important for the service coordinator to also have sort of that partnership as well. So if the owner doesn't have a direct partnership, then if there's a service coordinator at the property, they should be making those connections for the residents. And also too, before we give funds, we we ask owners to provide us like their proximity to these services and amenities, like shopping, um, public transportation, healthcare services, hospitals, any of those things that the residents need, we kind of give a preference to those properties that will be closer in proximity to those services. Or the owner could provide transportation directly to those services. So we want the residents to be connected within the community.
And in general, if a health center, for example, had a patient who might potentially,
Mhm.
have a disability, how do you go and help that resident? Who do they go to help a resident who might need services or might be eligible for 811?
Um, so I think that there's a couple of ways to access housing under the 811 program. What I didn't mention before that we do have two components of the 811 program. We have the 811, which we call our traditional, which provides for the construction and the operating systems. And then we have another program that is operated through the state housing agencies that have partnerships with the Health and Human Service or Medicaid agency. So if they're at a health center, they could be referred to either their Medicaid agency seeking housing. And if we have an 811 state program, they can go through that state program and get referrals that way and be referred to an 811 unit. Or they can have, any other some of the aging and disability resource centers. You can refer them to them. That oftentimes are connected to the housing the 811 housing that's available in the areas.
And does every state have a state agency that
That has an
partners?
811.
911? Yeah.
No,
Wow.
our goal is to have every state, but right now we don't have every state. We have about
Wow.
30 states at the
Okay.
moment.
Okay.
So we are in full, we are, looking at ways to make outreach to the states that currently don't have an 811 program to get them into the program. So we have definitely pushing it to ensure that maybe all 50 states could have an 811, some kind of 811 program. But there are plenty of there's over 31,000 of our traditional 811 units across the country.
Okay. And has the program grown of late, or is it kind of, status quo, or?
So for our 811 Capital Advance program, it's kind of like we haven't seen like a whole lot of growth, and I think those have been changes the to sort of like the services, and then you have Olmstead. So those things have made an impact on our traditional 811 program. Now for our 811, which we call the one through the state housing agency, we call the Project Rental Assistance Program. 811 PRA is what the nickname for the program is. We have we have seen increases in that program because it's coming with, services right at the beginning, like, the Medicaid, they're gonna be able to get their home and community-based waivers through that program, or money follows the person. They're typically tapping into those groups for the state housing agency programs in order to like have direct referrals into 811 units.
Okay. And you touched upon something a minute ago. You talked about Olmstead,
Mhm.
and which is obviously a very important decision. But can you talk a little bit about the impact of Olmstead and what it means in terms of the types of housing and the configuration of housing, and I guess the different types of disabled folks who might be in an 811 development?
So the impact of Olmstead was one thing that happened for the department. There was the passing of the Melville Act of 2010, which actually limited the amount of units that we could do in an 811. So previously we had independent, which would be 100% 811. So there were all the units within that building. There were typically about 25 to 40 units. They were small units compared to our other development programs like the Section 202, which have very large developments, but these were typically small. So Olmstead kind of capped that to 25% of the units within a building could be for or occupied for persons with disabilities to sort of have that integrated model. Another thing that we also seen, just historically, the impacts of Olmstead is that some of our group homes that were a little larger, that were more than eight persons, were closing. Like we noticed that some of them had closed because they were unable to get the services from the state. From our owner's perspective, they were saying that the states were saying to them that they were institutions, and so or the state was passing guidelines or policy or requirements through their Medicaid program that reduced the number of group home sizes to like 4 persons. So we're
Mhm.
starting to see, so the impact has been, now we're seeing smaller group homes, no more than 4 persons in a group home. We're also seeing more pickup of the condominium sites where they're scattered. So they may buy one unit in a condominium building, another unit here, and another unit there. So we're starting to see more scattered sites. This is all due to the impacts to Olmstead for a more integrated model, instead of a more where our independent living facilities where you lived in a, maybe a 20 unit 811, received all your services there, not much connections to the community. So now we're really encouraging that connection out to the community, um, with that 25% cap going into maybe a larger unit, maybe 100 unit, and 25% of those units are for 811.
So in the past, you might have had a development that was all people with
Mhm.
disabilities, or people who had some kind of cognitive disability,
Right.
or somebody who's developmentally disabled, and now that's no longer the way you do it. Are any of those developments still in place that were kind of
Well,
grandfathered? Or,
these are fairly new, right?
uh,
So, Melville passed in 2010, but the program hadn't had any funding from Congress from between 2011 to 2018
okay.
for any new developments of 811. So, but the new 811 PRA came in 2012. So we were able to do 811 units, but we weren't building any 811 until we received new appropriations in 2018.
Okay. And what challenges, I guess, and I guess, and what benefits does Olmsted, provide for the 811 program and the residents that it serves?
So some of the challenges I think is for some of our smaller mission driven 811 owners, like that were been a part of the program for many many years, and this is a huge change in how, even in the affordable housing development space, there's lots of changes. Like now, financing is, you have to get, there's many people, construction of new development is a lot more expensive, and so you have to get a lot of different people at the table in order to finance a new development. And if you're a small nonprofit, you know who who is mission driven, maybe you only serve, those who with developmental disabilities, you come into the table to, have a lot more funding at the table and be able to get, funds from your state, from tax credits and maybe other financing components, has been challenging. So we're not seeing, some of them, applying now for the program. We're seeing some of our larger um developers at the table. So we've really been trying to figure out how to focus and how to get those players back to the table for 811, because they're mission driven, they care about the program, they're invested. They're oftentimes has started the nonprofit based on maybe their personal experience or family. So we still want, them to be able to participate. So the department is, in the next year going to do a lot of outreach to figure out how can we bring, what are some of the challenges they're experiencing even in their existing portfolios. I mean,
Wow.
it's been kind of difficult to ascertain what the direct issues are. You know, we're seeing some vacancies in our 811s. Um, and some of that is could be attributed to aging housing stock, you know, or being in places where now we see a more centralized in a lot of states, a lot of more centralized of amenities and services in larger cities. And if you're out in rural areas, there could be challenges as well.
So you mentioned, I think you said there were around 30,000 811 properties.
Yes,
Right,
yes.
so that's a lot. So I guess how many of those are coming up on the need for renovation and renewal? And I guess do those grantees have the ability to renovate those properties at this point, or are they going to be looking for additional funding to do that?
So they're going to be looking for additional funding to do that. They're going to need that. We do have the new program called the Rental Assistance Demonstration Program, RAD. And right now, currently, 202 is able to do RAD. I think soon there may be some opportunities for 811 to do RAD.
Mhm.
This means that they will go move from like the operating assistance currently under the 811 to more of a project-based rental assistance, so Section 8. They will be able to, and then that will allow them to seek out other financing sources because as of right now, 811s are unable to have any debt service. So they're unable to get loans because the
Yeah.
operating assistance cannot pay for the loan. So, RAD will allow them the opportunity and more flexibilities to be able to get those capital dollars for preservation.
Now you talked about a minute ago about 202 and elderly. So
Mhm.
can you just explain the difference between the 202 elderly program and the 811 program for people living with disabilities?
So the 202 program serves older adults over the age of 62. It's very similar to the 811 program, but this is a different population, different residents. They are required to have services. They have the same, we pay for the construction and the development, and we also provide the same type of operating assistance in a 202. In the 811, the difference is that, we're serving persons with disabilities from 18 to 61. It doesn't mean like once you get 62, you have to move out of your 811. You can remain in the 811. But that's the major difference between the two programs.
Okay, well, that's a great explanation. HUD's numbers for people living with disabilities in traditional public housing are
Mhm,
that about 38%
mhm.
of the households have a disabled member. And for those folks who are receiving vouchers under Section 8, about 46%, have a family member that is disabled. So, and there's a lot of discussion, I think, in healthcare and in housing about aging in place
Mhm.
and how to make that happen. So I'm just wondering now, you've got a lot of folks, for example, who are, maybe living in an 811 funded, housing arrangement. And I guess how do they, or how do you fund that transition to, um, you know, to old age, as people, are getting on and so on? Does the funding continue under 811, or do they move into a 202? Or is it just if they get in before they're 62, or how does that work?
So if they're in there before they're 62, they can remain there. We don't move them. The operating system stays the same. They only pay 30% of their income. Nothing changes, but we do encourage owners to, you know, continue with their supportive services and their supportive service plan and evaluating that over time to kind of address the needs of those residents aging in place. We don't have any direct funding to for 811 to make any modifications to the home, but we do, we have encouraged our owners to continue to ensure that they're constantly reevaluating their supportive services to address the needs of the residents. Last year, we put out a notice for a supportive services notice. Even though in the programs have been existing for a long time, we felt there was need to make a policy, kind of make to make it more present in the policy that these supportive services are important and you should be evaluating your needs of your residents.
Well, so for the care team, the healthcare team, to kind of, if they're trying to figure out, where to seek services from, or consider what housing options might be available. Can you talk about, you mentioned before traditional public housing, and you mentioned, the conversions to RAD, the rental assistance demonstration program. And then we've got 811 and 202 housing and all that. So if I'm in a health center and I want to reach out, and I've got a patient who may need, services, or somebody who has a family member who needs services, or needs housing, should they call the public housing agency in their locality, or should they reach directly to the RAD folks? Or do they reach to one of your field offices, or what's the best way for them to seek assistance or seek guidance?
One, they could reach out to the local field HUD field offices, right? And they also provide information on the housing that's available in the area. You can reach out to the housing authority, just for other options. Like I don't think you should stop at one door. I think you should try to tap all doors, to see if there's anything available. Also, if a state has a lot of state housing agencies have different programs outside of HUD as well. So that are able to, so go to your, state housing agency and find out what programs are available. And even some of the Health and Human Service or Medicaid agencies have partnerships with the housing, um, with the state housing agency, and they, also do referrals. So like, not stopping at one door, going to all of those doors are very useful in trying to find housing for someone who needs assistance.
Okay, and excellent. And so is there somebody, I mean, is there someplace where a health center or anybody else who's interested can find out a list of the states that have 811 programs across the
Oh, yeah.
country?
So we have the HUD Exchange. It's sort of a branch off website. It's our technical assistance website that has all types of resources on there. And the 811 PRA has its own page on the HUD Exchange and has all the states and the state contacts who they can reach out to if they need, any assistance. They come across the patient that may need housing.
Excellent, 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 excellent. And so please, so what is the, I guess, the URL for HUD Exchange if somebody wants to get up there and take a look?
So the URL is the HUD Exchange .info.
Okay, all right, very good. And Chantel, who is working with today and kind of producing this podcast today, Chantel, if somebody has a question that they want to follow up with, what is the email address at nchph.org that they can send an email to if they have a follow-up question?
If anyone has a follow-up question, they can submit an email to info@nchph.org, and we'll respond promptly.
That's perfect. Well, Katina, thanks so much for joining us today. I think this is a kind of a great explanation, a great overview of what the 811 program has to offer. And I would love to have you come back at some time in the future and maybe provide even a little more detail on how progress is going, I guess, in terms of evolving into perhaps, RAD developments and also growing the number of states that have 811 programs available to them. And again, thank you so much. And thanks to the audience for joining us. We are the National Center for Health and Public Housing. And we will look forward to future podcasts and having you join us again real soon. Thank you very much.
Thank you.
Thank you.
As a disclaimer, the contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by HRSA, HHS, or the U.S. government.